medicine doesn't have all the answers. They don't have all the answers. There are still techniques and practices out there that they don't know of, and by limiting themselves to what they read about in the journals, nobody's willing to take a step to find out if there's a possible treatment that will actually work, that will meet or exceed the expectations to treat some of these other conditions. And if, as long as the sources and everything are fine and the health is fine, I don't see any problem with examining every facet or opportunity to get to that point of treatment. My name is Larry Brothers. I practice optometry in Joplin, Missouri. I'm in Springfield at the Stem Cell Awareness Seminar this afternoon, where we got a chance to hear about some of the other opportunities available for people, and for the students, for the kids, for the families, to have stem cell treatment as a treatment for their kids to change their lifestyle. I've seen 7 or 8 kids in the office or family members in the office that we have done follow-up that have had the stem cell therapy, and we've talked to about another probably 7 or 8 more along the way, just to help them with some of the directions that they needed. So what I see is that the question that a lot of people ask me is why don't we do this in the United States? And personally, what I think it is that and I have had conversations with some of the networks when they would ask me, why don't we do this here? And I told them that my biggest feeling of it is that the politicians who insist on grouping the fetal and embryonic cells that would be tied in with cloning and abortion into the umbilical/adult cells. And if they would separate them, they know that there are 80-some conditions at that time, last I checked, 80-some conditions that are treatable, acceptable by the FDA with the umbilical cells, with success, and there are 0 successes with the fetal and embryonic. If they would take a step back and look towards the one and focus on the one that they know does work and set it apart, then I think that you're more likely to see that sooner. But there's so much controversy on just the words, the 2 words stem cells, that everybody has negative connotations about it. 2 of the 8 were SOD and the others were ONH, but some of the children are more profound in the depth of their conditions, and you may not have the verbal communication. You may not have the child that sits down there and carries on a conversation, but when you still talk to the parents of those children, they still are touched by the same things that they see the development changes in their child, even with the SOD, even if it's something that is more profound. The child may not get up and run across the room, but there may be looks or responses that are, to me, would make it worth it as a parent. I have one. There is one that we had questions about whether it was not. And actually, he's one that has done the best. He's one that has done the best of all of them that we've seen. We thought that he might have been misdiagnosed, but he was. The others felt that the diagnosis was correct, and they did the procedure on him, and he is actually the one that has improved more than anybody else. That he is the one that is running through the house, and he sees last time we saw him, he was about 2060 to 2080. He is doing just fabulous with what he's got. With some of the individual kids, we have seen the first child that we saw was seeing about 24,000 one day or one month post-op. They were down, which is the big E at 2 feet. The next visit 1 month later, they could see down to the 3,000 foot letter, and so it was a 25% improvement in 1 month. That same child is now down to about a 2,600 letter. That is the best one that I've seen is around 2,160, 2,100, somewhere in that range. And these are kids that had various degrees of blindness or partial blindness, light perception. But the biggest thing that we see is their functional vision. They are running in the house without bumping into furniture. They are picking up things that are dropped on the floor. They are seeing the things around their house that everybody else takes for granted. They can see their mother's face. They can see the fireworks. They can see the lights on the Christmas tree. Things that everybody else just overlooks. You don't see perfection when the people that you see have gone through this, but you see significant, dramatic functional improvement in their quality of life. Do they see 20/20? No, but it's just a number. They do things, they can function better now than what they did before the treatment.